Yes. I'd like to ask the Honorable Dr. Dwayne Sands, Minister of Health, to provide you with an update on the Ministry of Health's COVID-19 response. Minister Sands.
Thank you, Dr. Dalregis. Good afternoon. I begin today with the latest information on COVID-19 in the Bahamas. Sadly, we announced today 2 additional deaths from this coronavirus. A 53-year-old male and a 51-year-old male who died at Doctors Hospital West. This brings the total number of COVID-19 deaths in the Bahamas to 11. We give our heartfelt condolences to the families of the 2 men who lost their lives, and our prayers are with you in this very difficult time. There are 2 new COVID-19 cases. A 50-year-old female of New Providence who is in home isolation, and a 29-year-old female of New Providence who is also in home isolation. This brings the country's total number of confirmed cases to 72. 61 from New Providence, 7 from Grand Bahama, 3 from Bimini, and 1 from Cat Key. 15 of the 72 confirmed cases of COVID-19 are healthcare workers. There are 2 new recovered patients for a total now of 14 recovered. We have 9 hospitalized, 8 in New Providence at Doctors Hospital West, and 1 in Grand Bahama at the Rand Memorial Hospital. There has been much public discussion over the past few days regarding the medical surgical ward at Princess Margaret Hospital, and so I'd like to provide you an update on this situation. SRC, or Sandilands Rehabilitation Center, referred a patient from the Robert Smith unit to Princess Margaret Hospital for further medical management on April 5th, 2020. This patient received treatment at PMH and was discharged on April 15th, 2020, back to Sandilands Rehabilitation Center. Days later, the Medical Surgical Ward 2 of PMH was declared compromised on discovery of a confirmed positive COVID-19 patient on the ward. Consequently, the ward was closed to admission on April 18, 2020. The patient of the Robert Smith ward from SRC was returned to PMH on April the 19th to be tested for COVID-19. And on April the 20th, it was confirmed that this patient from the Robert Smith unit had contracted COVID-19. And this patient is now receiving care at the Doctors Hospital West facility. The remaining 39 patients at the Robert Smith unit at Sandilands were immediately placed in isolation, and the unit was sanitized. 46 staff members at Sandilands were identified for risk exposure assessment. In total, more than 200 healthcare workers are in quarantine. However, we believe that upon completion of our risk assessment activity, this number is expected to be reduced dramatically. 1 staff member, 2 patients, and 2 registered nurses were quarantined for 14 days. Subsequently, all remaining patients on the Medical Surgical Ward 2 were tested for COVID-19. Contact tracing and exposure assessments commenced for the people discharged from the ward and those who were in contact with the current patients on that ward. Currently, there are only 4 patients on the ward. 3 of the 4 remain in isolation, and 1 remains on the open ward. As long as patients remain on this ward, routine sanitation measures are being followed. High cleaning will be done as soon as all patients are discharged. As a precaution, and in order to take proactive steps to protect their health, all persons will be monitored closely, they will be tested for COVID-19, and if required, they will be admitted to one of our COVID centers for care. We are committed to providing all necessary support and treatment through every step of this process. As part of our updated prevention measures to mitigate the spread of COVID-19, visiting hours at all public and private wards at PMH have been suspended. Patient updates will be made to the identified and/or the nearest relative or guardian by the assigned physician by telephone. Meals and beverages delivered for patients will not be accepted during this restricted period. If a patient requires a personal item, the hospital will contact the identified and/or nearest relative regarding the request. In this case, delivery must be prearranged with the ward staff. Efforts are being made to provide video conferencing for our patients on the children's ward so that they can interact daily with a parent or guardian. In an effort to expand our treatment capacity, we opened the South Beach Acute Care and Referral Center. The southern, northwestern, and northern wings of the center were converted to isolation rooms. The air conditioning system was changed from positive pressure to negative pressure. And the center has also been divided into 10 discrete zones. These steps were taken to improve air safety. The negative pressure of the air conditioning prevents patients and staff from coming into contact with airborne droplets. We also use ultraviolet light to clean the air, making it cleaner than the air in a standard operating theater. We have also created an adjusted workflow for staff, patients, and medical waste, and designed systematic and independent safe staff zones, including bathrooms and rest areas. Out of the 10 private rooms created at South Beach, there are 8 with ensuite bathrooms. Each of these have appropriate airflows. There's also continuous upgrading of the positive and negative airflows, sewer, toilets, and showers for patients and staff. All retrofits have been completed according to the standards of the American Society of Heating, Refrigerating, and Air Conditioning Engineers, the World Health Organization, and the U.S. Centers for Disease Control and Prevention. South Beach Acute and Referral Center started to accept COVID-19 patients on Sunday, April 19th, following refitting for accommodations for the first 10 beds. The South Beach Center will be further refitted to accommodate an additional 10 beds, bringing to 20 the total number of beds for COVID-19 patients at that facility. Contractors are working around the clock to complete these additions by this weekend. This should bring the total number of beds for COVID-19 patients in New Providence to 40, 20 at South Beach, 16 at Doctors Hospital West, and 4 at the Princess Margaret Hospital Modular Unit. By tomorrow morning, 6 COVID-19 beds will be available in Grand Bahama, and within a week to 10 days, a total of 22. The work of the Ministry of Health's Communicable Disease Surveillance Unit is key to the fight against this coronavirus. The hard-working staff of this unit are important frontline workers in keeping all of us safe, and so I would like to highlight their work to you. This unit is responsible for collecting and evaluating health information to control the spread of communicable diseases in the country. It responds to disease outbreaks. It gives healthcare facilities a description of communicable disease symptoms and the protocols to follow. It informs healthcare providers and the public of infectious diseases that could affect or are currently circulating in the country. And it works with private and public clinics and other stakeholders to identify cases. This unit leads our contact tracing efforts. Contact tracing is a fundamental public health tool that can break the chain of transmission and decrease the spread of an infectious disease. On average, there can be 10 to 20 contacts from one infected person. The surveillance unit uses the following three-step process to find these potentially exposed people. Step 1, which we call contact identification. During this process, once a case is confirmed positive for COVID-19, staff members speak intimately with the person to determine what activities he or she was involved in and the persons or people he or she came into contact with around the time that the illness began. The contacts given for such a case usually include family members, workmates, friends, or healthcare providers. Step 2, contact listing. During this process, all contacts noted are listed with information on how to reach them. These people are informed that they were exposed to the coronavirus. They are provided with information about the necessary steps to take to avoid potentially exposing others, such as quarantine. Step 3, contact follow-up. This process requires following up with the contacts once to twice daily to monitor for symptoms and potentially to test for infection. Contacts of COVID-19 are monitored for up to 14 days to determine if there are signs of illness developing, such as a fever, a dry cough, or shortness of breath. Once symptoms develop that meet the case definition, these persons are immediately referred for COVID-19 testing. If they are found positive, then they are also questioned about their contacts, and the cycle on contact tracing begins again. People who have been exposed to the virus are required by health officials to limit their contact with others to prevent spread. This can be done by quarantine or by isolation. Quarantine is used to separate and restrict movement of people who are well, but may have been exposed to the coronavirus. Quarantine, in this instance, is usually for a period of 14 days from the exposure to a confirmed COVID-19 case. During this time, the person is monitored to see if he or she experiences flu-like symptoms. People may be required to self-quarantine if they visited an area or country where community infection is present, or if they were in close contact with a COVID-19 patient. Self-quarantine takes place at home and lasts for up to 14 days. If a person starts to feel sick during self-quarantine, that individual should contact his or her healthcare provider or the COVID-19 hotline. Those in mandatory quarantine are placed in a designated quarantine facility and are monitored daily by healthcare providers. This allows for monitoring for the development of symptoms and early detection of a case. This, too, is usually for a period of 14 days. Isolation differs from quarantine because now a person who is ill or infected needs to be separated from others to prevent the further spread of infection. For people with mild flu-like symptoms such as low-grade fever, dry cough, fatigue, runny nose, and sore throat, they may be isolated at home. They must remain in a separate room away from the rest of the household. If more moderate or severe symptoms develop, such as shortness of breath or difficulty breathing, then hospitalization in an isolated room at the South Beach Center or Doctors Hospital West facility in New Providence or a similar facility in Grand Bahama will be required. To those who have received recommendations to quarantine or isolate, you are strongly advised to remain at home until the prescribed time has ended. Since you as a quarantined or isolated contact have been exposed, you have the potential to spread the virus, shed the virus, and infect others, and accelerate the spread of this disease in the Bahamas. Contacts who have had close association with a positive COVID-19 case are considered to be at high risk of infection if they share a bed, if they slept in the same room for one or more nights, if they live in the household and share the same enclosed living space for one night or extended periods of time, or if they are a healthcare worker who provided direct care without using personal protective equipment. Moderate to low-risk people are those who travel in close proximity with a COVID-19 patient and who were in a social situation with no physical contact or close proximity to the case. Those in quarantine and isolation should request a family member to complete shopping for essential items. If this person lives outside your home, ask them to leave the groceries and other items at the door and to leave. If you are receiving assistance from a family member at home, then ask them to leave your food outside the door and not to enter the room you occupy. Following this simple advice is paramount to preventing the spread of COVID-19 in our communities. The surveillance unit provides valuable information and helps to inform the government on what decisions should be made to halt the further spread of coronavirus. Contact tracing has provided a number of benefits. One, patients are able to receive care if they're detected early. Two, contacts can be transferred to a treatment center so the infected person is taken out of the community and isolated so as not to aid further COVID-19 spread. Or three, it can prevent the extension of the pandemic. I want to thank the surveillance unit for their hard work. I also want to encourage you to donate blood. There remains an urgent need to replenish our blood supply. To add to the ordinary blood donations you can still make at the blood banks, a national blood drive has been organized. And we are encouraging all who are able to give blood to join me on Wednesday, April the 29th, between 8 a.m. and 5 p.m. at the National Stadium to donate blood. Remember to eat at least 30 minutes before you donate. You will need identification, so please bring either your driver's license or your NIB card. You cannot donate if you are sick or if you're experiencing respiratory symptoms. So please come forward and make a donation. This simple act will save lives. On the 21st of April, 2020, the Prime Minister signed the Emergency Powers COVID-19 Number 2 Amendment Number 10 to give effect to improve medical, therapeutic, or other patient care in homes and residential facilities. Consequently, all medical, therapeutic, or other patient care providers are expected to submit the following documents to the Chief Medical Officer of the Ministry of Health. 1, a valid government-issued identification. 2, a current residential address, telephone number, and other contact information. 3, evidence of training and certification to provide medical or therapeutic care. 4, details on care provided to and contact information for current patients or clients. And finally, to undergo infection control protocol training provided by the Ministry of Health prior to providing any further care. Additionally, a current license to practice is required. Once the requirements have been submitted, the Ministry of Health will issue a letter to therapeutic and other patient care providers to continue to provide care. The Ministry of Health advises that persons can contact the CMO at 502-4708 or 502-4855, or by email at covid19@bahamas.gov.bs to submit the required documents. I end today by thanking all of you who are staying home and following the public health advice. Continue to do so. This virus has killed more than 185,000 people around the world. Staying home as much as possible is our best weapon in the fight against COVID-19. Thank you, and good afternoon.
Thank you very much, Minister Sands. The Minister has asked me to share with you the projections to date. And so I'd like to invite you to look at the most recent graphs. When last we spoke, we showed you the impact of the shutdowns. There has been some relaxation of some of the restrictions. Next slide, please. And this is where we are now with the long-term projection from one of the curves. The other curve I showed you, the model is not fitting, but you see an increase in the number of cases. We should expect that the increase will continue and will be greater, given the situation in the medical surgical wards at Princess Margaret Hospital, as well as the increased testing that is projected beginning today and throughout the course of next week. Next slide, please. This curve, we're looking at another model that gives you a different slope. And at the end of next week, we don't know whether this model will fit, but we will continue to look at various models given the data that we have and the number of cases, so we are better able to project what might happen over the course of the next 30 days. Next slide, please. You see, this is the current daily and cumulative number of cases and deaths. And we had 2 recent deaths in the purple, and the cumulative cases are still on the rise. Next. Next slide, please. And this is a very busy slide, but it shows you the cases that we have and the clusters that are occurring at work sites and at various places. It is busy, but what you see are the total number of chains. So a chain brings together all those cases connected, that are connected. And so if you look at chain number 8, you see many cases are clustered. You look at the other chain, and you see characteristically all males. And that is, these chains are evolving and would not be static. So in a week's time, I will show you another cluster of cases. But this is how the surveillance unit is monitoring each case and each possible chain that's occurring, the linkages that are occurring with the cases. Next slide, please. And this, the minister has asked me to share with you the most recent self-isolated staff by category, which causes him quite a bit of concern. And Minister, I don't know if you wish to highlight the healthcare workers in this slide.
Thank you. As we look at this very unfortunate graph or projection, it shows the number of physicians, 96 physicians, who have had to be isolated or quarantined because of exposure to COVID-19, and some 62 nurses only from Princess Margaret Hospital. This does not include nurses, doctors, porters, X-ray technicians, and other staff members from the Sandilands Rehabilitation Center. And we show this so that you can understand just how significant COVID-19 can be in terms of depleting the number of staff members who would be available to take care of you and me.
Thank you, Minister. We now open for questions by our distinguished reporters. We begin with Matthew Moxie from Eyewitness News.
Hello.
So if he's not ready, could...
Hello, can you
Hello?
hear me?
Yes, and we can see you as well.
Okay, perfect. Now I know the Prime Minister would have recently announced that we would have a complete lockdown every weekend in April. Now we are approaching the last weekend in April. Is it the recommendation of your task force that these lockdowns continue beyond April?
The answer is yes.
Okay. And then also related to the first death in Bimini, there would have been an investigation underway for, I guess, the reason behind the death, as well as the long wait time it took for the patient to be airlifted. Where are we in that official investigation?
We have continued to do contact tracing of all the members that might have come into contact with the case. Since that time, we've had 2 more cases. And where we are, we have air transport with a patient isolation unit. And the last case was brought out 3 days ago, from Bimini in a patient isolation unit. So air ambulance is transporting these patients with the necessary protective gear from the site to the delivery at the institution. Okay. Shashina Rome, please, ZNS, Northern Division, Grand Bahama.
Hi, good afternoon. My first question, how many persons remain in quarantine and how many recovered on the island of Grand Bahama?
Okay. The number that have recovered It's increasing. We were told this morning that they had an additional 2 that were recovered. The total for Grand Bahama, I think it's 7 that have been in isolation, and 3 have been recovered fully. They continue to monitor the recovery. The numbers are recovering, but they're ever changing.
Can you give us the number of persons who remain in quarantine?
No, I do not have the number who are in quarantine.
We just heard a little bit about what happened in New Providence as your hospital was compromised. Here in Grand Bahama, our patients remain in tents and pods at the Samaritan's Purse. My question is, if what happened in Nassau happens here, do we have a contingency plan already in place?
Your team down there, comprised of Dr. Bartlett, Dr. Lockhart, he also has Dr. Pedican, the hospital administrator, and all the medical internists are on full alert with Dr. Hegde, the epidemiologist, monitoring the situation. What we're told, we have an emergency operations center meeting every day with Grand Bahama. They report the findings, and we're assured that they're on top of it. They have the adequate number of swabs. They send up swabs very regularly. They monitor the flow into the emergency room as well as into the community clinics. And right now they have 1 admission who is stable, and they intend to discharge that individual. I may have a correction with the number of recovered. I'd have to refer to Dr. Bartlett. I'm not sure he's on the call. Rashad, roll, please.
Yeah. What is the assessment of the health team in terms of how the opening of some businesses went this week with regard to accomplishing the social distancing priorities? And did you all observe anything that would lead you to recommend to the Prime Minister that he revisit his decision to open up the businesses?
Do you mind repeating the last part of that question?
Did you all see anything that would lead you to recommend that the Prime Minister revisit his decision to reopen the businesses?
We are recommending that there be no relaxation of the restrictions, no further relaxation of restrictions.
Okay, so to date, it has been the policy to test people in quarantine only if they have symptoms. And I wanted to know, is there a risk that releasing symptom-free people from quarantine without testing them during or at the end of the 14-day period has given us a false sense of security about the ability of some of them to still spread the virus, especially considering 60% or more COVID carriers don't show symptoms ever?
That's an excellent question. And we wrestled with this. We had a real concern when we had restriction on the resources of swabs to follow the protocol that was initially set out. Instead, what we did was we introduced the WHO risk assessment tool, and we agreed to follow these cases very closely. Now that we are in a better position with resources, we would certainly revert to testing those who have completed 14 days of quarantine. And if they're negative and still symptomatic, we cannot call them recovered. Kyle Joaquin, please.
Hi, this question is for Dr. Dwayne Sands. Over the weekend, when you all closed the ward, health providers, well, doctors who have interacted with these patients who tested positive, apparently they're not being tested. They were sent home for 14 days. Just want to know, why not test them? Because some of them can be asymptomatic carriers.
All doctors will be tested, and we have started testing. We would have gotten the list of all of those, not just doctors, but healthcare workers. And so we intend over the next few days to complete the testing of all exposed healthcare workers.
Okay. Now, given that situation where the ward had to be closed because patients came in COVID-free and now they're leaving, obviously, or they contracted it there. Can you speak confidently and say that we still have a handle on this? There are some countries accepting help from Cuba. Is the Bahamas there as yet where we can bring in healthcare professionals from Cuba?
I don't believe that this is an issue of not being able to handle it. The index patient had symptoms that were inconsistent with the typical or usual, even the extended definition of COVID-19. The patient presented with neurological symptoms. The healthcare teams, many of them experienced, competent clinicians, did not make the call. The patient subsequently spiked a temperature, and at that point was tested for COVID and determined to have COVID-19. We are doing an external review to look at the management of this patient and all of the patients from the time that the patient arrived at the hospital up to present. And when that investigation is done, we are happy to share those results with the public.
Thank you. Shamako Lightburn. Hello. But before that, we have a correction with 4 recovered from Grand Bahama and 20 are still being monitored and are decided as in quarantine. Shamako Lightburn, please.
Hi, good afternoon from the Blaze 98.3 FM in Exuma. Fortunately, today we've had another increase in recovered cases. Is there any data that the Ministry of Health is currently working with to suggest that antibody testing or serology testing would be beneficial in any way in studying discharged patients at this time?
That's a good question. I'm going to pass that to the Minister.
Who's going to punt to Dr. Forbes?
Oh, Dr. Forbes.
Good afternoon. Thank you very much for that question on antibody testing. Unfortunately, we and the rest of the world remains plagued with having an accurate antibody test. These antibody tests do not perform very well to date. They don't detect when people have disease, and as a matter of fact, they can find people to be positive who are not really positive. It is a conundrum. We do need the test. Just yesterday, in another educational forum, we were talking about when this test is available, what we can use it to do. Can we use it for surveillance? Can we use it to determine what is the population level? Can we use it for screening? However, the resounding answer at the end of that is until you have a reliable test, we cannot use it for diagnostic purposes. It would be unethical to do so. And so we wait to have a test that is indeed accurate.
Do you have another question?
Yes. So secondly, this question is really based from our viewership here in Exuma. A lot of parents, particularly new parents, have been concerned about the delay in getting immunization for their infants or their toddlers. In particular, we know that a lot of private practices are closed at the moment. A lot of other healthcare facilities are being repurposed, such as the South Beach Clinic. So just to alleviate the anxieties for those new parents, is there a large concern if their children have to have a delay in getting those immunizations?
I'm going to punt to Dr. Brennan.
Good evening. So absolutely, that is a concern for us. We know that it is a challenge being able to get our young children in, especially infants, to get their immunizations. So there is some delay that is currently happening, some just out of fear, some out of closure of offices. And so what we are currently doing is putting together a strategy to make sure that we redesign parts of our immunization program to make it more community accessible, and even thinking about delivering immunizations in people's homes as opposed to waiting for them to come to us. So given that this outbreak has happened for as long as it has, and the fears of people coming into our institutions, we are now going about redesigning the way we've done it all these years and seeing how we can really bring it to the community level and even to the home level rather than just making sure that people come in for their regularly scheduled visits.
We are trying to cover all bases. Rachel Knowles, please. I understand you're on audio.
Good afternoon. I know that you've already touched on this before, and you were asked if you all will recommend for the lockdowns and curfews to be extended past the end of this month. Do you know how long exactly you all expect to see these measures extended? And also, I know that you said that you all aren't planning to relax the measures any more than they already have been, but are you all going to recommend to make them more strict again?
That will be determined. We are only recommending that no further relaxation of restrictions. A lot is going to depend on the cases and how the country performs in terms of the measures already put in place. Social distancing, no large gatherings, more than 10, hand washing, and all the measures that you have been promoting in your media, if they are adhered to, and if our case presentations warranted, we would certainly revise our recommendations. Minister, do you have a comment?
No, I believe that the more adherent we are to the public health advice, the sooner we're going to get out of this. And so it becomes almost counterintuitive. People are anxious. They're tired of being cooped up in the home. They are concerned about their finances and whether they can get back to work. And I think that the more adherent we are to these interventions and initiatives, the sooner this will end. And then we will have to be deliberate and cautious and careful in a methodical rollout of the reopening. At this point, we have no time for that. We have no date when that is going to happen, at least not for the recommendations to the competent authority.
Do you wish to ask another question, or are you good?
No, I'd like another question. I know that you said that you all are looking at different models now based on the number of new cases we've had. From those models, are you all able to give a ballpark date range of when we expect cases in the Bahamas to peak?
That's an excellent question. Let us hope that it is this week. We're following it very closely, but I'm unable to say because the model each week, based on the findings, we have to look at the various models and see what fits the data. The data that comes in from the cases is not only the number of cases, is the data, the onset of illnesses, when symptoms begin, the time of the lab testing. There are many variables that are considered with the models. So unfortunately, I cannot give you a date, but I'm hoping that given the situation that we were in a week ago and where we are now, that within a week's time, we'd have a better idea. Plus, we're putting in, as you've heard the minister say, additional measures that prevent the spread of asymptomatic individuals in the community, and we're testing more. So there's a delicate balance, but we'll have that determination probably in a week's time. We may not. We're hoping that we do. Jeminita Swing, good day.
Good day. My first question, as we all know, we're seeing the phased reopening of the country. How confident are you as it relates to the Family Island that there will be no additional cases? For instance, we see the mail boats still operating and servicing those destinations. how are we ensuring that no, I guess, spread will be as a result of that or any other interventions based on the management?
Very good. We get daily reports from the Family Islands. We're testing any symptomatic cases in the Family Islands, and the swabs are transported to Nassau very quickly. What has been reported in the Family Islands, that they have implemented various measures to protect themselves. Example, it's been reported to us that they police the docks, and when someone comes off for food or for fuel, they wait for them to return. They practice active social distancing. The discipline there seems to be really on target. And we've tested Exuma, testing has taken place in Exuma, Eleuthera, Bimini, Harbor Island, North and South Eleuthera, and so far we've had no positive cases other than in Bimini and Grand Bahama. But Grand Bahama is not a family island, they tell me.
Okay, so my second question relates to one of the slides. I guess Dr. Sands can take this on in terms of the PMH self-isolation, the numbers for, I think, 96 physicians, 62 nurses. What impact do you expect the removal of those persons to have on your ability to deliver care to patients?
It has a real negative impact. There are certain services which have been decimated. If you listen to the comments made by Dr. Loxley Monroe, a seasoned, experienced general surgeon, he speaks to the fact that his team has been reduced to 2. There are other services where almost entire teams are wiped out because persons have been sent home. Now, that said, not every person has had a high-risk exposure. And the process that is ongoing through employee health is to use the World Health Organization risk stratification to determine who is high risk, medium risk, low risk. And we expect that when that assessment is done, that a number of persons will be able to safely return to work at the Princess Margaret Hospital and at Sandlands Rehabilitation Center. But the initial default position is that everybody who could potentially have been exposed goes home, and then methodically each one is determined to see who needs to come back, which persons get tested first, so that we can maintain a safe clinical environment. Pardon me? We do have the medical chief of staff at Princess Margaret Hospital who can speak to this directly, Dr. Carolyn Burnett.
Good evening. So a number of our staff members have been sent home on quarantine, but we are mitigating the situation so that we have adequate clinical coverage. Before this all started, we put measures in place, including discharging as many patients as we could. So our census is quite low at this time at Princess Margaret. We have stopped elective surgery and all clinics, and therefore our workload was decreased. We skeletonized staff to prepare for a possible surge in COVID-19 cases. So we are coping and providing adequate clinical care at this time.
Thank you. Elizabeth Byron.
Elias, good afternoon, Dr. Dal Regis. Can you hear me?
Very well.
Yes, just expanding a bit on the answer that you gave to Jiminita about testing. The expanded testing that was supposed to start today that you mentioned, you said there was some testing that has happened in Eleuthera already. But in terms of the expanded testing, does that include the family islands like Eleuthera? And what does that currently look like? Who's being tested?
We're testing all contacts of cases. Bimini is a particular target for us right now because you've had 3 cases. Cat Key is taken care of. All the residents of Cat Key were tested, and the one case is negative. The retest is negative. So we have Cat Key with no cases and all the residents tested. We're hoping to expand the testing in Bimini, having had 3 cases now. And that is pretty advanced in terms of setting up the teams and scheduling for persons to be swabbed. And then we have to have the swabs sent to Nassau for testing. The other case is tested negative. So you have no case, no reason to contact trace. However, if you have symptoms and you are unwell, you are tested.
Thank you. The second question, specific to Eleuthera, is are there any persons currently, as a result of the contact tracing, are there any persons in Eleuthera, Harbour Island, Spanish Wells, currently in quarantine or isolation? And if so, in which areas?
Do you want to take that? The answer is yes. I'm doing the punting job.
So we are aware of less than 5, I believe it's 3 persons who would have presented with unusual symptoms. They were quarantined. They have not developed any overt evidence of COVID. We have tested, I believe, 1 person in recent times from Eleuthera, and that was negative. So across the archipelago, there is testing being done. And as Dr. Dallery just said, the process in Bimini, for instance, started even today. And we expect to test as many as some 40 or 50 persons from Bimini between today and tomorrow.
RTV, Mr. Jerome Sawyer, please.
Good afternoon. My first question has to do with the classification of the deaths. Of the 11 deaths who have been confirmed to have died from COVID-19, can you explain to us the difference in an individual who would have died from and who would have died with? Is there a distinct difference? That's a question that continues to come up.
Good. Can I pass that to Dr. Forbes?
Thank you very much, Mr. Sawyer. That's a really good question. And so, yes, there is indeed a difference. There is some classification systems. The Centers of Disease Control is just one of those places that has a classification system. And it speaks to a COVID death as being a death whose underlying cause is due to COVID or related to COVID, which is very different than somebody who dies with a COVID infection. So my minister gave a very good example yesterday. So if someone is crossing the road and gets into a motor vehicular collision, that's a term, right? And dies, and they have a COVID infection, but they die because of their polytrauma. They died because of the trauma, not because they had a COVID infection. Versus somebody who gets very sick with COVID-19, they would have died because of COVID infection. And so yes, they're quite different and they are classified differently, and that's a global standard.
My second question has to do with the surgical ward at PMH and Sandilands. Are you concerned that these instances and what has subsequently happened will deter people from coming to seek help at these facilities? And have there been any similar instances?
You were breaking up, but the question is, is it a deterrent for patients to come to Princess Margaret Hospital?
Yes, and has anything similar happened at any of the private medical facilities?
In Nassau or globally?
Countrywide, in the Bahamas.
The answer is that there is assurance given by the executive management team of the Princess Margaret Hospital that once the ward reopens, it would be properly sanitized and ready to receive patients. We've also ordered an investigation, an independent review of processes and procedures that have taken place to date, and I think that would give further guidance if there are other corrective measures that should be done. As I showed to you, that we have clusters of cases, and one of the clusters, the early clusters, occurred in a private institution. And that institution is also engaged with an investigation of causes of the spread in their institution. And they've taken further measures to look at the actual contacts, and they're testing everyone who might have come in, be in that as part of that cluster. So, and they too are sanitizing. We await the report from that institution. We should have the report from the Princess Margaret Hospital by midweek next week. Our last person is Roston Jones, please.
Good afternoon. Good afternoon.
I'm trying. Good afternoon to you, sir.
Thank you. There are two parts to my first question. Can you state the number of healthcare workers who've been infected with COVID-19 and how many of the 200 healthcare workers or so in quarantine have been tested for the virus?
The first question, I think the current total of healthcare workers infected with COVID-19 is 15. In terms of the total number of healthcare workers tested, I do not have the answer to that question.
Understood. I believe Dr. Del Regis had remarked last week that based on data modeling, if the country continued to see 2 to 3 cases per day on average, this would reflect exponential growth of the virus. I think since Sunday, we've seen 12 cases. This is despite the curfew and lockdown measures in place. So the question is, what additional measures are being recommended or considered to help curb the acceleration of cases beyond what is currently being done?
You are correct that we were looking at the exponential regression with 4 cases being the ceiling. We started at two cases with an interval of 2 days. Then we started to see 4 cases per day, and that rose into, that went into the exponential regression from a linear to an exponential regression. Now we're seeing a sigmoid relationship where you have increases, the sigmoid curve, as you, I don't know if they can show that graph, that is really giving us a different slope for the increase of cases. Now, I would submit to you that there will be an increased number of cases related to the investigations that are ongoing in the medical surge as a result of the outbreak situation in the medical surgical ward of Princess Margaret Hospital. And we still have community spread. So collectively, there is an explanation for the increased number of cases. And we will have, and I anticipate that we will have to go into a different set of modeling once we have the data in the next 5 days to really see where we are in terms of what might be the forecasting over the next 30 days. So it's ever changing. But I thank you for that question. I think you're the last person. Do you have another question as we conclude? They say no. Thank you all very much for your attention and for your good work. Have a good afternoon. Thank you.